First things first, there are 17,446 confirmed aggregate cases of coronavirus in Victoria. That is 216 new cases since our last update. I'm saddened to have to report that there are now 363 Victorians who have passed away because of this global pandemic. That's an increase of 12 since yesterday's update. Our thoughts and prayers and best wishes are with the families of those 12 people, and we wish them well at this very difficult time. The information I can provide you is that 3 of those 12 are males in their 70s, 4 females and 1 male in their 80s, 3 females and 1 male in their 90s. All of these deaths are linked to aged care outbreaks. There are 675 Victorians in hospital. 45 of those are receiving intensive care and 29 of those 44 are on a ventilator. A total of 2,008,630 tests have been processed, which is an increase of 16,109 tests since yesterday, and I'll return to testing in just a moment. There are 3,751 cases with an unknown source, mystery cases. It's an increase of 82 since yesterday's report. That's it, 82 closed out at the conclusion of that investigative process. There are 1,065 healthcare workers who are active cases. There are 2,050 active cases in aged care settings and 7,155 active cases across the state. Just to give you both an aged care and a disability update before I give you an update on a number of business support initiatives and partnerships that we have that we're announcing, and others that we can report progress on. In aged care, as at the 19th, total number of cases associated with aged care facility outbreaks since the 1st of January is 3,337, of which 2,050 are active cases. To give you some further breakdown of those active cases, 5 of those are in public sector aged care and 2,045 of those are in private sector aged care. Similarly, as you would expect, in terms of outbreaks, there are 120, 6 of those outbreaks, with 2 co-located on the one premises, are in public sector aged care, and 114 of those are in private sector aged care. In disability, there are 79 active cases in those disability facility settings. That's as at the 19th, 79 cases, of which 19 are in transfer facilities, so facilities that are transitioning across to the NDIS, 60 that are actual NDIS services, and I know there was 1 in a state-run facility. There's now 0, so that means that of the 60 outbreaks, that's 79 cases. Of the 60 outbreaks, it is 19 in transfer and 41 in NDIS. Total staff cases 60, total resident cases 19, and all 19 of those are in NDIS services. I think that's probably all in relation to the kind of the virus numbers for the day, but I wanted to take you through a number of other important updates. The Upscale My Business program, which is a very important program to provide vital skills and support to small businesses in particular, around diversifying, around adapting, around building stronger on the other side of this 1 in 100 year event. That's 25,000 Victorians have accessed that program, and we're very pleased obviously to provide that support with our partners. That's a very significant take-up. There's just under 130 courses that are offered, and they cover a whole range of different elements of adapting, different elements of trying to make sure that those businesses are as strong as possible on the other side of this event. So we're very grateful to Deakin University and RMIT, who have been our principal partners in providing that support. So 25,000 Victorian users of that scheme, which I think is a very meaningful take-up. Secondly, last week we opened our $26 million Small Business Mental Health and Wellbeing program, and today we can announce that we're joining with the Victorian Chamber of Commerce and Industry, the Chamber, in launching a new business mentoring initiative as well. That's all about helping businesses to navigate the challenges, very significant challenges that this virus poses, and that'll match small business owners and sole traders with experienced professionals who can provide that mentoring support. We're very grateful to Becky, to Paul Guerra and his team for their very positive partnership, not just on this but in lots of different programs, lots of different elements of our business support package. We're very grateful for that positive partnership, and it's always best to engage in that very meaningful way to design programs that will meet the needs that are there, but also to have a willingness to adapt and change those programs as the virus adapts and changes and has different impacts today that it might have, say, 3 months ago. Now, I had committed to come back to you in relation to business support fund grants and payments to individuals. So we're now at around $1.3 billion that's been provided to more than 75,000 small business operators across the state. That's a total of $20,000 available for eligible businesses in metropolitan Melbourne and Mitchellshire, of course, noting their now historic inclusion in the then Stage 3, and $15,000 available throughout the rest of Victoria. So that is a very significant undertaking, and of course we don't rule out providing further support in the event that that is needed. In terms of test isolation payments and the isolating at home if you have in fact tested positive, so that's all about people who don't have sick leave to fall back on, those insecure worker payments for want of a different term. $450 test isolation payment has been provided to in total, 19,500 Victorians, so that's $6.5 million worth of payments that have been made. That's a very significant uptake, and I think that's directly dealt with one of the challenges in terms of people getting a test and then not potentially isolating while they wait for the test result, the notion of not being paid if they didn't work the shift. So that, I'm very pleased to see so many people accessing that payment, and I would again say to anybody who's got symptoms, please come forward and get tested. If that will mean you're out of pocket while waiting at home to get your test result, there is that now $450 payment available to you. Provided you don't have sick leave to fall back on, or you're not on some other payment like a JobKeeper payment for instance, then we will make that payment to you, and we'll do that as quickly as we possibly can. In terms of the $1,500 coronavirus worker support payment, which the Commonwealth, I'm pleased to say they've now taken over that payment. We look after a number of ineligible groups. So, for instance, those who don't have permanent residency or aren't citizens. But in broad terms, there's $10.4 million has been paid out. That's to 6,900 workers who have either tested positive for coronavirus or been a close contact, and of course had to isolate for that 14-day period, and they too don't have sick leave to fall back on. Can I thank obviously the federal government in relation to their most recent work around that payment, but can I also thank the union movement as well as businesses who have worked with us closely to design and to indeed increase those payments where that was deemed appropriate, going from $300 to $450, particularly in relation to that test isolation payment. Now, I also committed that I'd come back to you with a number of updates in relation to WorkSafe enforcement. So as you know, we've got COVID safe plans across the board, but particularly focused on a number of high risk settings, although any workplace without proper safety can be a high risk and a really significant risk of transmission given the widely infectious nature of this virus. But since we announced our workplace inspection blitz on the 19th of July, WorkSafe have now visited some 724 workplaces and issued 62 notices to employers. That takes the total number of inspections since the beginning of the pandemic to some 4,911 and 168 notices in total since the pandemic began. That's across a whole range of different industries. I want to thank our WorkSafe inspectors and other authorised officers, Victoria Police, others who are involved in that work. And the clear message is to all employers, we are checking, we are monitoring to make sure that everyone's playing their part, everyone's doing as they should to do nothing at all that might contribute to the spread of this virus, and we're grateful to the vast majority who are. But that compliance framework, those checks, are a really important way of making sure that all of those different decisions are being made in the best interests of public health, and I might say in the best interests of that business. Obviously, to have an outbreak, particularly if you might have contributed to it, that's a pretty significant issue and not good for your business. So, in general terms, though, those numbers are with 724 and only 62 notices to improve, and there'll be a range within that 62 as well. Some of those may well have been quite minor matters, others may not be, and if I can provide you with any follow-up on that over time, I'm more than happy to do that. But it is across different workplaces. There's no hard and fast trend, if you like. They are going and inspecting in lots of different parts of the Victorian economy. There is obviously additional work in the higher risk settings, but that's not to say that if you're not in an abattoir, you don't need to deliver each and every element of your COVID safe plan. Everybody has got a role to play in that, and we're grateful to those who are, and for those who aren't, of course, the point needs to be made. We are WorkSafe, are out there checking, and if you're not delivering as you should, then there's every chance that you will be caught doing that. But again, thank you to all those who are. And just on testing, before I ask Brett just to speak to the numbers for the day, at some 16,109, that's a little bit less than what we would normally average out at around 20,000. There'll be a number of different factors for that. As we spoke yesterday, movement. Obviously, there are far less people moving around the community. That may mean that testing for some is not as convenient as it might otherwise have been. But the real point that I would make again is if you've got symptoms, even very, very mild symptoms, and particularly given the really clear points that the Chief Health Officer and others have made, with such low levels of flu, if you've got symptoms, then there's every chance you've got this virus. And the best and most important thing to do is to come forward immediately. So as soon as possible after the onset of even the mildest symptoms, come forward, get tested, stay at home till you get your result. If you need support, then obviously these numbers today show you that there's very strong support there for you. We've got to keep these testing numbers up. Now, there will be a trend here over time as we see numbers to continue to fall, as we see less virus in the Victorian community, then the total number of people who've got symptoms should be falling as well. But again, I just urge people, if you've got symptoms, come forward and get tested. We've got to keep those numbers as high as we possibly can, so that we've got the most complete picture of what's going on out there. This is not a problem at this stage, but it's always, I think, a good thing to remind people and to ask people to play that important part in our fight against this wicked enemy. Come forward and get tested, even if you've got really mild symptoms, because those results not only mean we can put measures in place with you and your close contacts to make sure you're not infecting anybody else. It means we can give you support and assistance if you need that, and it also means that we've got the most complete picture of how the virus is presenting in different parts of the state at different times. That intelligence, that data, is very, very important in terms of making really important decisions, very impactful decisions in the weeks and months to come. I think that probably covers off most of the things I had committed to update you on, and there's a few more that are still in train. I think Victoria Police will be out later on today. Deputy Commissioner will be Rick Nugent, I think, will be running you through a whole lot of enforcement data. I'm not quite sure of the exact time of that. I'll leave Victoria Police to inform you of that. And health worker transmission, so all of those, which won't just be clinical staff, but aged care workers, hospital workers, clinical staff, non-clinical staff in each of those settings. We had a long public health meeting last night with all the team. That's getting close to being finished, and as soon as it is, which I think will be by the end of the week, we'll be able to come back to you and just take you through a few of the insights that the data gives us, as well as some of the changes that we're making. Often small things, but they're all about trying to make sure that we keep the people who are keeping us safe from this virus. I might just hand over to Brett now, and then of course we're happy to take any questions you have.
Thank you, Premier. So 216 new cases today. That is a little bit less than yesterday. I think I spoke yesterday about the fact that Wednesdays can be spike days. We've seen some batching of results that sometimes in previous weeks have led to Wednesdays being a very big day. So I'll take 216 as a figure that's slightly less than yesterday as a good sign. But we do have to bear in mind that testing numbers have gone down. We don't want people who are out there with coronavirus to be missing out in these numbers. Every case that we find is an opportunity to stop transmission through isolating those individuals and following up their close contacts. But there has been a stabilisation. The active numbers are down by 119 today. The number of active cases in aged care is stabilising. The numbers in ICU and on ventilators has been pretty stable in the last couple of weeks. It is a pressure for the health system, but it is very good to reflect on the fact that it's not 10 times that amount, which it quite easily could have been. We shouldn't underestimate the challenges of second waves. Relatively speaking, Victoria's done pretty well globally with a second wave. There are countries that are being challenged by waves that are as big, if not bigger, than the first waves that they've experienced. That applies to Spain. Israel's the same. France is going through a really significant spike at the moment, and there's an uptick in Germany and the UK. So to be on the downslope of our epidemic curve in Victoria is a really good sign, and it does speak to the fact that we're doing very well in relative terms with a very challenging situation. I've talked about the fact that this wave is very different from the first wave. We've got complex outbreaks in aged care settings, disability and other complex workplaces that make it very difficult to get on top of the numbers quickly, but we are trending down, and that's a very good sign.
Falling quick enough for you? We were, I think, August 8 around the 700 mark. Are we going in the right direction quick enough?
Oh, we're going in the right direction. Numbers will never fall fast enough for me. You know, we all want them to be below 100, below 50, below 10 as soon as we possibly can. But it's within expectations, and it is trending as we have kind of modelled based on the effective reproduction number. So that's encouraging.
Is the community transmission coming down enough?
Look, I think community transmission is also trending down, as we would expect. There will be that interplay between workplaces and households. So as we get on top of it in households, there'll be less new outbreaks in workplaces and other settings. We've only got an additional 4 outbreaks today. That is one of the smallest numbers that we've seen for many, many weeks. So yeah, trending in the right direction. But again, I would like to see a day of 0 new outbreaks and very little community transmission.
And in regards to Ballarat, have you identified the source of infection? What's caused that clustering in Ballarat?
I'd have to go to the specific regional picture because they're different in Latrobe Valley and Bendigo and Geelong. But Ballarat, yeah, we have mapped it out. I'd have to come back to you about the specifics there.
Is it community transmission?
I think for most of the regional areas, we've identified that there are workplaces, schools for when they were on site, and for some aged care settings in regional Victoria, but I don't know specifically for Ballarat offhand.
Throughout the whole time, like since March, has there been an outbreak at a supermarket? Has there been an instance of a super spreader, say, giving it to a whole lot of customers in a supermarket setting?
We really would have great difficulty in finding a super spreading event at a supermarket. People will list a number of sites that they've been to in the previous 14 days. Almost everyone lists a supermarket, so it's very hard to identify a single event unless you get all of those pictures coming together that everyone's been to a particular place on a particular day. We have had cases in staff, multiple staff in supermarkets, so we're aware that there are transmissions between staff members that might have come from clients or might have been staff-to-staff transmission as well. But it is tricky to, in those open areas where there's a huge volume of people coming through, to pin it down.
So I'm just trying to make sure I understand it. It's low risk and unlikely, but you can't rule it out, getting it at the supermarket?
Yeah, I think that's fair to say. It's relatively low risk. People are spacing pretty well. Their face-to-face time is very limited. Obviously, there are screens for a lot of the checkout staff, and people are wearing masks, so I think it is a low-risk setting. We'd always want people to minimise their visiting to get food and other essential supplies as much as possible, because transmission can occur. If someone is very infectious, a mask won't do magic. It'll reduce the risk, but if someone's very infectious, and they're in a supermarket setting, they could absolutely transmit to others.
And just one of your rules, can you just explain the logic? I can walk 3 kilometres to my local park to exercise, but I can't drive 3 kilometres to my local park to exercise. Why not?
Look, we are aware that people have talked about that as an unreasonable constraint. I'm happy to talk to the Chief Commissioner of Police, Shane Patton, about what the threshold should be for that. I don't want anyone to feel unsafe getting to a place of exercise. If we can make revisions around the directions, if that's required, happy to do that. But it might just be a matter of clarifying interpretation with the Chief Commissioner.
Today was supposed to be the day that Stage 3 restrictions ended. Why do you think it was that they didn't work?
I wouldn't say that Stage 3 restrictions didn't work. There's been analysis of the Stage 3 restrictions that it did bring the effective reproduction number down below 1 or very close to 1, and it was up above 1.6. So Stage 3 restrictions absolutely made a difference, and really the effects that we've seen over the last week are Stage 3 effects, as well as the effects of universal mask wearing. So it did work, it wasn't enough, and it was going to slow transmission to a point, but as the Premier's mentioned previously, it would have had a really, really long tail. We would have gone into September, October, November with ongoing cases at reasonably high levels, and that's an impossible situation to be in terms of tolerating what Stage 3 restrictions represented for us.
Just on Frankston Hospital, there is an outbreak there. Can you tell us when you became aware of that outbreak and how many people are involved and if you found the source of it?
Yeah, I was informed of the Frankston outbreak this week, but it's primarily a health service response that is required. So Safer Care Victoria and our acute healthcare division have been very closely engaged in the response. Our Chief Medical Officer, Andrew Wilson, very involved, obviously, but there's been an immediate response, but now an incident management team because of the complexities of a large health service outbreak.
Do you know how many people are in that cluster though?
Oh, I think it's around 50 patients and staff included, but there'll be updates today on the exact numbers.
Can I just come back to the 5K thing? This isn't a criticism, but people, they see a rule like that and they go, oh my God, why didn't they think of that? Would you have sat down and gone through whether or not that is the rule and that is the regulation, or is your consideration not that fine-grained?
Not always that fine-grained. Obviously, I have a policy view. I don't think that people should be too constrained in that would put their safety at risk in terms of being able to get out and exercise. Again, I'm happy to hear, we're always going to hear reflections from the community about what it means for them in a practical sense. A lot of these things have been done with literally 150 pages of legal directions to work through. So there'll always be elements that come to us after the fact. I'm happy to look at them in detail.
Victoria has had 30 times the amount of cases that New South Wales has, but we've had half the amount of contact traces. How does that work?
Well, we haven't had half the amount of contact traces as New South Wales. We've got a very large contact tracing workforce.
That's just what was said this morning in an interview with the PM, so is that incorrect?
I could come back to you with the exact contact tracing numbers that we've got, but I think the workforce in Victoria is very substantial.
With the contact tracers, I think the ambiguity is how many people actually work in the phones. We get that it's a big team. We get there's a lot of people involved in the effort, but how many people have actually got a receiver to...
Yeah, that's what I can come back to you with.
Okay, thank you.
Do you need more contact tracers?
No, I don't think so. I think well, actually, we're still working through. We're onboarding people, so there is ongoing work for various functions within the broad contact tracing portfolio. So yes, we're onboarding new people. There'll be others who are finishing up their work with us. So it's an ongoing process in terms of building the team.
Given how the numbers have come down over weeks, has that made it easier to track every day? Are you sort of having more resources to...
Yeah, of course. As numbers come down, it becomes easier to manage, especially those complex settings, to triage them and to prioritise them appropriately and to get onto them straight away.
Can we just ask the Premier a few things? By my count, I think it's about 170 people have died in federally funded aged care, or more than that, I think, in August in Victoria. The PM was asked this morning on ABC Breakfast, if the buck stopped with him, he didn't say yes or no, but he did say we regulate it, but when there is a public health pandemic, they are things that are managed from Victoria. Who is responsible for the problems that we've had in aged care?
Raf, I'm not interested in getting into a process where I try and interpret for you comments that the Prime Minister's made. It may surprise you, but I've not seen the comments he's made. I've been briefed in general terms, but I did not.
You don't see that as an attack on your government?
Well, the only attack that matters is our collective attack against this virus. That's what I'm focused on, and that hasn't changed and it won't change. In terms of aged care, what I can say to you is that we have been asked to provide support and assistance. We're doing that. I don't have a number of shifts today, but it was getting very close to 2,000 shifts yesterday of hospital nurses that have nothing to do with private aged care going in. We've got a joint command. We're all working together as best we possibly can. That's what my focus is.
Can I just ask in good faith, because you often say we have been asked to help.
Yeah,
sometimes people federally see that as you having a dig at them.
Well, I can't. Well, again, I might make the point to you that if that's the biggest thing that some people federally are worried about, then I would respectfully say to them, they've not put that to me. They might be putting that to you, Raf. It's part of your job to talk to them, and maybe they give you insights that they don't bother sharing with me. But that is not the biggest concern in the state of Victoria at the moment. The biggest concern is getting on and fighting this virus, and these numbers show us that we are seeing numbers come down. But whilst I'm in no way disagreeing with the optimism that the Chief Health Officer has, and I'm hopeful as well about this, but I wouldn't want any sense of complacency to come into anyone's mind. This is still, we've got a long way to go, but the numbers are going the right way. I would say to every family who has a loved one in aged care, we are working as hard as we possibly can together. It's not about who signs the paycheck, it's not about the colour of the uniform, it's just about getting the job done, and that's what I'm exclusively focused on.
Can I just ask then, who is in control? Because I guess the criticism in the past around the hotels is, and you're not able to answer some of the questions, which is the reason we have an inquiry.
Indeed.
So day to day, is it Daniel Andrews Premier who is in charge of the response? Is it the Chief Health Officer? Is it the head of the Health Department as the
We've got
Controller?
the State Controller is Kim Peake as the Secretary of the Department of Health and Human Services.
She's in charge?
Well, she's the State Controller, but I think we've had a debate and a discussion, well, not so much a debate, we had a discussion about organisational structures and documents that, well, they're 5 years old. In some respects, they might as well be 50 years old, given the unique nature of the event that we're dealing with. It's not one person in any one role, it's a team of people, and they come together very, very regularly. Like, for instance, last night I had a lengthy meeting with a group of people who are running the contact tracing program, with the Chief Health Officer, with one of the Chief Health Officer's deputies, various secretaries, including the State Controller, and we went through a very lengthy agenda that was everything from how the app is working all the way through to aged care outbreaks, all sorts of different issues. That occurs every couple of days, and then in between there are too many meetings to mention. But it's a big team because it has to be. No one person could possibly coordinate every single element. They all have well-defined roles, but it's within a structure that reflects the task. And it is a structure that you can't necessarily go to a document and say, oh, that mirrors exactly, because the event doesn't mirror anything that we've experienced before.
Just on the reflections that are passed on to me,
I'm very pleased that those reflections are passed on to you. I'll take your word for what they say, yes.
It's pretty clear that when the ADF came in, they thought it needed to be a simpler command structure, that you needed to have one person at the top of the structure. So I'm not asking you to give your opinion on that. I just want to know if that was ever passed on to you. Did anybody else say, listen,
again, I'm not.
Yeah,
well, let me just to preface my answer to your question, and perhaps I shouldn't really be getting into answering questions that are put by people. I don't know who these people are that have apparently shared these views with you, but Commodore Hill, we're very grateful for the work that he's doing, absolutely, and all of his team. There was some commentary recently in recent days that attributed to him some criticisms of structure, and as I understand it, he took it upon himself to write an email to a very large group of people just a couple of days ago to indicate that he had no such view. So that's that's what I'm told the email says. I haven't seen the email, but I think, again, you know, we've got a big enough job to get on with here without getting into some of these, I think, sideshow issues. They really are. We've got a structure that is filled with people who are highly skilled, highly motivated, and are working incredibly hard to get this job done. Now, that doesn't, you've got a job to do, and each of you can have views and theories and opinions. That's exactly what you're there for, and to report facts and whatever else you want to do. But I don't have the luxury of getting into some of that stuff. But again, we're very grateful to the ADF in all the different roles they're playing. Many of them, well, sorry, at least a number of them have been here from when I first requested they come to Victoria, just between Christmas and New Year's.
You said your discussion last night included how the app is going. How is it going?
Oh, look, I think we're just keen to see as many Victorians sign up to it as possible. To download the app. That electronic handshake is a very important thing. Not so much now, can I say, because we're, you know, the vast majority of us are at home, and we've probably got a pretty good sense of who our close contacts are if we're not at home. But certainly on the other side of this, you know, these numbers we've dramatically reduced movement. We're seeing numbers come down. The app on the other side of this will be very important. As for instance, in the New South Wales example, I'm not sure how many cases were detected by the app, but if you look at that Crossroads Hotel outbreak, where you had, and that's very different than where we are now. We haven't got hundreds of people in pubs, but we will get to that point again at some point. That's when the app will really come into its own.
So up till now, how many Victorians has it identified?
Oh, I think it's very few. But that isn't a criticism. That's just we're in a different place, and again, it's not necessarily a frontline tool now. But again, it'll be of greater use the more people that sign up to it.
Premier, just on aged care, you
Yes.
just made a point of highlighting how many more cases there have been in private aged care facilities than in state-run ones. What do you think has created that situation?
Oh, I don't think we'll know. I don't think that we can necessarily have any, you know, particularly definitive views on that. And in some respects, it wouldn't be for me to do that work. As we know, Rachel, the coroner may look at some of these matters. There is some other legal action that may or may not run, there's obviously an aged care process as well that sits above all the work that we're doing, and indeed it's a national process. But I can't speculate on that, and to the extent that I can, I don't necessarily think it's helpful at this time when we've got a number of facilities that are still in crisis. We've got a number of facilities that are still in very challenging circumstances. I don't think there's much to be gained by us trying to speculate on those matters.
And why did you choose to highlight those statistics? Because to the lay observer, it looks as though you are trying to sort of highlight that things are better in the system that you run than they are in the system that the federal government
People can make their own judgments. I'm not seeking to make any other point than the facts, and they are the facts, and I've consistently presented them that way. And if it's okay by you, I'll continue to do that. That is the appropriate thing to do. Just like a public hospital outbreak would be reported, just like a private hospital outbreak. You know, ultimately, it really, I don't know whether we've got the time to be reading down into literally every syllable that the Prime Minister or I say and trying to find an argument. There is no argument. The argument is with the virus. That's the only argument that matters. And I'll be speaking with the PM later on today, actually, and we'll be talking about lots of things, and I'm pretty confident one thing we won't talk about is a syllable by syllable breakdown of the language he uses and the language that I use, because we just don't have time. We just don't have time for that.
Lieutenant General Fruin told a Senate committee yesterday that ADF troops were put on standby March 27 to help with hotel quarantine. Is it now fair to say that you perhaps got it wrong last week when you said that ADF troops weren't?
Well, whether it's fair or not, some will probably say that, but that, in my judgment, is not fair at all. He's confirmed that there were troops stood up. No one's ever questioned that. The point here, though, is the comments I've made are in no way whatsoever inconsistent with the statement that Andrew Crisp has put forward, and he's the Emergency Management Commissioner, and I would direct you to those statements.
So you're still saying that the ADF was not offered to help with hotel quarantine?
Well, I think you'll find that's what Commissioner Crisp is saying.
And it's what you said last week?
Yeah, so, well, again, I think we've probably covered this ground a fair bit. I think we're pretty...
Have, but this is just what came out yesterday. Lieutenant
Well,
General
no, what
told
came...
the Senate committee that troops were put on standby to help with
But
hotel quarantine.
no, hang on a minute. No, hang on. No, see, this is... I think it's always very important not to necessarily take what someone said and then apply, which is quite a narrow statement. No one's ever questioned that there were additional troops or ADF personnel and decisions were made by the ADF. If you read Andrew Christ's statement, and that'd be, I think, a really good thing to do, to have a look at the fine detail, well then that I think deals with the issue.
What was the area
around offers and requests? That's the point of contention, not whether there was a decision made by the Australian Defence Force. And I think if you look at the ADF commentary yesterday at the Senate, I don't think that's in any way inconsistent with what Andrew Crisp has said, and nothing I've said is inconsistent with the Emergency Management Commissioner's comments.
Because you've said that hundreds of ADF personnel wasn't on offer on March 27 to help with hotel quarantine.
Well, I think the key point...
You this last week when there were reports that came out and then the ADF confirmed it.
Again, with the greatest of respect, the word offer is the key. Have a look at Andrew Christ's statement, have a look at my statements, and they're in no way inconsistent. I would again just put it to you, you're free to ask any questions you like and I'll answer them as best I can. But we've spent quite a lot of time on this. It is months ago. It is not, I think, the most important issue in my judgment. You're free to make a different judgment, but in my judgment, there is absolutely no inconsistency between what I've said, what Commissioner Crisp has said, and what was led in evidence at the Senate yesterday.
You did say last week that ADF were only providing transport in New South Wales and Queensland, but the General said yesterday they provided concierge and security duties.
Well, again, the point I'd make to you is there were some discussions at various points about providing transport assistance just like New South Wales here in Victoria, and ADF I think made the point, this is in no way a criticism, that the Skybus arrangements that we had in place, they would only essentially replicate that, so that there was no need to do that. I think I've made that point to you before, or to all of us, I mean. Again, I think I've covered these matters in quite some detail, and I'm providing you no different information today than I've provided you all the way through, because that is not only my accurate account, it is an account that is 100% consistent with the Emergency Management Commissioner's account.
Defence says they did knock you back on. Sorry, Defence says they did knock you back on a request for aerial.
Apparently,
support.
yeah.
What aerial support?
I cannot. I am not aware of requests. I'm not questioning that the answer was no. I'm happy to try and follow up for you. I think it related to drones. I think drones have been used in other states to try and surveil some public spaces. I'm not sure. We have. I think Victoria Police have used some of that technology. I'm not sure what they might have asked for some support that wasn't forthcoming. I'm in no way critical of their decision to not provide that, but I'm happy to try and follow up for you.
Who would have asked for that?
I'll have to come back to you on that. And look, at the end of the day, I don't think that anyone is asserting that that would have been a pivotal thing, and that we're in one set of circumstances because that wasn't granted. That is not the issue. I think it was simply a matter of fact that that was asked for, and the answer was no. I'm not making any value judgments about that whatsoever. In fact, the details of the request are not known to me. I'm more than happy to chase it up, though.
Do you think Victorians would be concerned, though, that we're asking for the military to put drones up to spy on us?
Well, I don't think that's what they would have been for, Lundy. I think they might have been.
No, I mean, neither do we.
Well, let me follow up then. That probably confirms the need for me to follow up. I wouldn't read any more into it than logic tells me, and I'm happy to get the details for you, that it would have been about trying to monitor movement in one way or another, or whether crowds were gathering as they shouldn't have done, things of that nature.
Andrew Crisp said in his...
Sure.
Where are you in discussions as far as Term 4 is concerned? I know children aren't required to wear masks right now, but is that something that could happen in Term 4, that children would return if they wore masks, or what measures are you looking at?
Yeah, look, I think it's a little early for us to talk about what Term 4 will look like. Obviously, we've got the balance of Term 3, the holiday period, and then that is still some weeks away. And look, I think our general approach has always been, let's try and give parents and teachers and staff, school communities, as much notice as we possibly can, including students, of course. Let's try and give them as much notice as we can. But I think parents and everyone I just listed would probably accept the fact that it's a bit early now to be talking about what term 4 will look like. But our teachers and staff, students and indeed parents have done an amazing job, both when we were at school physically and of course in terms of the flexible and remote learning. It isn't easy, it's very challenging, and as soon as we can provide clarity about what we think term 4 will look like, then of course we will.
Related to that, the school holidays,
Sure.
Should people be anticipating at least, I guess, stage 3 restrictions through those school holidays, or at least some sort of travel restriction?
Yeah, it's kind of the same answer, I think, to Chanel's question. We need to be very careful just to be guided by the data, and it's really difficult to know where we'll be. That's some weeks off, so it's very challenging to work out exactly where we'll be at that time, and I wouldn't want to try and predict that when I think logic tells you and the data tells you and international experience tells you that this is not only wildly infectious, but it can be wildly variable. So there'll be a time when we've got more certainty and we can speak directly to those issues. So, what the next set of rules might look like, but that is not today. And I get that that's very frustrating for people. People want certainty, they want to know what's next. But what we have to be focused on as the next thing is continuing to see these numbers come down. And then that, of course, will just give us more options. And that's why the key point here is, in every way, we can't be complacent. We have to acknowledge this is a long haul. And yes, it's frustrating. Yes, it's painful. If there was an alternative, then we would pursue it. There isn't. We've just got to see this through. And in many respects, the most important thing you can do is as soon as you get even the mildest symptoms, please come forward and get tested. And then please stay at home until you get your test result. That's just a massive thing that you can do. It seems very simple, but it's a huge contribution that each and every symptomatic Victorian can make towards our collective fight against this.
Just on the Oxford vaccine, what is your thoughts on that? Is it a sense of hope?
Look, anytime there's a breakthrough or a sense of progress, we've got clinician scientists around the world in unprecedented numbers who are working as hard as they possibly can to try and unlock this riddle and to provide us with what we all need. And look, we're very grateful to them. I think there's some positive signs. They've been pretty well reported today. I think the PM's made some announcements about that. And as we've always said, you've got to have that kind of scientific breakthrough, so what you need to do, then and prove it up that it works. Then you have to actually make it. You've got to manufacture enough doses, and then there'll be the process of obviously administering it. They're all pretty big feats in their own right, but it's...
Front part, we had it inspired directly from Tron. It was kind of like the light cycles that they ride on, the motorbikes. The wheels look really sort of futuristic and have a blue glow. So like every time you send a signal, we're going to flash lights through, either backwards or forwards. We're still deciding on that. Yeah? Yeah. Very cool. Give a bit of a feeling of power. Yeah?
I'm leaving Riley and his family to get ready.
You gotta eat on the run, because you're not gonna have time.
Tomorrow, they're all travelling down to Sydney, where Riley gets to test our technology.
I think Jordan will make me a superhuman because I have the faith in him.
Making a lot of funny noises.
Why did that happen?
Back at the warehouse, the 3D printer that's making Riley's headband is giving us problems.
I'm about to have a heart attack because it's not working. It starts off and then just midway through the first layer. Really stressed out. I'm really nervous that it's not going to finish in time and it's not going to work, and yeah.
And Maggie's not the only one getting stressed. Nick and I are having trouble making all of our devices talk to each other.
So now we're just going to add your little sneaky output.
Yeah. We're setting up so that
where the likely transmission has occurred and what factors are at play, because we clearly need to work at patient-to-staff infection, but staff-to-staff transmission, either on the ward, at lunchtime, whatever it might be. And it's not to preempt what those findings are. I think we need to look at each and every one of those aspects, and we need to make sure we're working at each and every one of those aspects. And they're not about just PPE, but PPE is absolutely front and centre in our thoughts, but they're also about patient flow, staff movements, infrastructural issues, ventilation. So all of those things need to come into play as we do that analysis.
And are people still working across different facilities in aged care?
In aged care, I think to a degree, yes, they are. It's probably a question for the VARC in terms of how much that can feasibly be constrained. From a public health point of view, you want to minimise that to the fullest extent possible, but there are no doubt practical constraints on that.
Was there a delay in the genetic data for the Ridges Hotel? It was sort of mentioned in the inquiry yesterday that it was first discovered about May 30, but perhaps not presented until June 30. Was there a delay there?
No, there have been regular reports that have come through to the intelligence team on genomics regularly. So the report that I provided to the Premier was a later report. There would have been earlier reports on a 2-weekly basis, probably.
I'll just ask you again on contact tracing. Sorry. The PM says there were offers of help for contact tracing from day one. Were there, I guess, what were they, and did we take any of them up?
Oh, I'd need to go back and have a look in terms of detailed offers, but
yes,
well, there you go. The Chief Health Officer, no less a source than the Chief Health Officer, has confirmed that. Look, we've had, and I'm happy to go back and get you some further information if I can, but we've had some of those ADF experts that are about teaming, tasking, logistics, all of that they've been here since the bushfires. So we have sought and received help and assistance on a regular basis from a multitude of sources, whether it be, and I'm not sure whether the comment was specifically in relation to ADF, but there's been other Commonwealth public servants that have helped, Services Australia, for instance. I think they're playing a role. We've got private sector, whether it's Hello World, who are stood down because there's no travel, but are doing a great job for us, making contact with lots of different people. Medibank Private, so that health direct service, which is nurses, basically, who are doing some of that work for us, in fact, a lot of that work for us. It's a team that's now bigger than it's ever been because the challenge is bigger than it's ever been.
Premier, can I ask a couple of questions about issues on the state borders?
Sure.
We've had reports of people on the South Australian border struggling to get permits before they come into effect on Friday. Is that something your government's heard, and is there any work that you're looking to do with South Australia?
Yeah, thank you. It's a very important question. There's a power of work going on at the moment. Jack Symes, as the Regional Development and Agriculture Minister, is leading the work between our government and other governments. People will have, I'm sure, noted overnight, yesterday afternoon, I think, the farmer permit issue. I'm not being boastful in any way. I'm sure there are some who still don't believe that's enough, but it's a significant step forward with that 100 k's either side. So agricultural workers, just making sure that the border closure, and we understand why those border arrangements have been put in place. We just want to make sure that has the least impact possible. On South Australia and farmers, I can't give you an update on that. Our principal focus was New South Wales in the first instance, but we'll work through the South Australian issues as well. I spoke about students yesterday, so that hasn't changed. We're still working together to try and make sure that there's a freedom of movement for students who might live in Victoria but are educated, particularly senior students, are educated on the other side of the river. In terms of South Australia, I know that Jack Symes has been speaking at length with her South Australian counterparts, and as soon as we can provide any further updates, we will. But I've had a whole range of different issues raised with me, and we've tried as quickly as we possibly can take that local knowledge, the local example, if you like, and then feed that into other governments. And by and large, despite the fact these arrangements do have really significant impacts, I think we've got a good hearing on each of the issues we've raised, but that doesn't mean we can always get the answer that we want. Those border closures are there for a reason, and if they weren't inhibiting movement, then they wouldn't be serving the purpose that they're there for, and that is to try and stop the virus spreading any further than it already has.
South Australia's Health Minister made it clear in an interview yesterday that their rules are stricter for Victorians than they are for international students who might be coming to South Australia. Is that fair, and what do you think about that on behalf of Victorians?
I haven't seen those comments, so I resist the temptation of giving you a commentary on them.
Can I ask about the hotel quarantine reset?
Yes.
Will you wait for the outcome of the inquiry before you reveal what the reset will look like?
Well, the reset is basically Corrections Victoria running it with some where appropriate Victoria Police support. It's a reset also that involves, rather than subcontracting arrangements, a number of people who have moved and become permanent employees, or will do once the demand grows. So they're directly accountable to a public sector agency, so they become a public servant rather than a private contractor. There'll be some private contractual arrangements where that is appropriate. I think that rather than when you say reset, do you mean the resumption of return of overseas?
Yeah. How much of the recommendation?
I think that, to be honest, I think that is probably more the resumption of returned overseas travellers flying to Melbourne and being quarantined here, if that's the question. I think that is much more captive to getting past this second wave than waiting definitively until Judge Cote has handed down her report. It could be both, but I think the first order issue is to wait and see how quickly we can continue to bring these numbers down and just how volatile the circumstances are. So that's what really prompted me to say to the PM, look, we can't take flights at the moment. We've got to be 100% focused on this challenge, and that's exactly what we're doing. Sure.
Professor Sutton, what is your advice regarding the safety of holding the local government elections in October? Is that something that can go ahead?
That advice is being worked up. It'll be known when it's landed, but we're not there yet.
Would it be possible under stage 4?
Stage 4 isn't expected to go into October, but we're not there yet.
Fair enough. One more, please. Thank you. Is there an update?
I've known not to start walking when there's a moment of silence.
Have you got an update, please, on the Joint Disability Task Force?
No, I don't. But we remain committed to trying to essentially replicate the arrangements that I think have served all of us well. And again, it's in no way to try and diminish the challenges that we've all faced in aged care and the grief and pain that families are feeling right now. But I think those arrangements have brought some stability to a previously very unstable set of arrangements. So I think it works, and that'll be one of the things I talk to the PM about today. I just think that it makes sense for us to try and stand that up. We've got our rapid response we've put in place now, but again, I've said this, I don't know how many times I've said this, but I'll keep saying it because I think it's really a really important point. We're at our best when we all work together, when we're all focused on a common task, and that's premiers, prime ministers, people in business, people in every community, people who have got it, close contacts, people who are living in a community with no known coronavirus. All of us are at our best when we work as closely together as possible. And that's exactly what we've tried to do. And I think that the aged care example, from a command and control point of view, I think that there's some utility to that if we were to expand it into the residential disability sector.
Sorry to raise one thing, if I can.
That's okay.
We've been told by one parent that the police came to check on their child not engaging with remote learning. I'm pretty sure it's a public housing tenant, somewhere like in North Melbourne. That the police came to check rather than social worker or education department person.
Yeah, I haven't heard that, but I'm happy to follow it up.
Just seemed a bit unusual.
I'll follow it up and we'll probably provide you that answer off air, just to try and make sure that we're safeguarding the privacy of any person in that environment.
Just on the business support fund, no doubt that's been a tremendous help to many businesses across Victoria, but what do you think Melbourne in particular will look like off the back of this virus? Is it going to look like a very different city?
Oh, look, we know that this global pandemic has done enormous damage to businesses large and small. There'll be a massive program of rebuilding. these next couple of years have got to be all about jobs and skills, and making sure that we stand with every person who's lost their job, every person who's wanting to retrain to work in different parts of the Victorian economy. You know, there'll be some, I don't want to be necessarily providing a long commentary on this, but I think that things like insecure work have been exposed as just a toxic thing that we need to do something about, and something meaningful. I think that there'll be some other behavioural issues, so just the way people live. I think we're going to see more people working from home more often, not necessarily every worker every day of the week, but I think that for some people it's no longer a concept where they might have some doubts. They've done it and they can see that it might well fit into their family circumstances better, for instance. So we'll have to provide for that. There'll be a whole range of challenges there. We will have seen, perhaps some confirming of trends that have been there for a while, face-to-face retail versus online, all of those sorts of things. So there's a massive job to be done here, but I think Victorians are equal to it. And you look at it, 25,000 businesses that have come to us via that service to learn about how they can adapt to try and turn the challenge of this virus into a clear opportunity for them and their staff. That's a very good thing. We'd all, of course, prefer not to have to deal with those challenges, but that's the powerful reality we face. So I think there will be some significant changes. Not all of them bad. There may be some good things also, but that shouldn't in any way be read to be downplaying how big the challenges are. They're huge, and that's why we'll waste no time at all, whether it be in the budget or in other work that we're doing. A clear plan for jobs, that's what's needed most now.
I guess I would ask, do you think that would be still one of the world's most livable cities?
Well, that's for a panel of others to judge. I think that Vienna had pipped us the last little while, but I'll leave it for them to judge that. What I'm focused on is making sure that we get past the health challenge, and then we have a really, really determined focus on creating jobs and trying to repair the damage that's been done, the hardship that's been experienced. I think the Victorians will stick together, and we'll all work very hard to achieve that. And there's a power of work already done, and other work that's being done around jobs and skills, and the strength that we want to put back into the Victorian economy, and by extension the support that we want to give to Victorian families, many of whom are doing it very tough.
Premier, have you advanced those discussions around making COVID-19 a proclaimed illness for the sake of workplace compensation?
No, I haven't. Well, I think that in the first instance, the Attorney-General, in her capacity as Minister for Workplace Safety, I think is turning her mind to that, and that is to say that there'll be officials in her department that will be looking at that, because there's been some correspondence and some requests to look at it. So I think I made a similar comment when I was last asked about this. I could try and get an update for you.
Premier, the number of fines issued by police for rule breakers doesn't really seem to be dropping that much. Yesterday there was an example of someone going out to buy a fish tank. What's your reaction when you see some of these rather bizarre excuses given by them?
Well, they're not very effective, are they? Because, Victoria Police can see through that, and that's why that person got a fine, I would think. Yeah. I've tried not to necessarily focus too much on the people who are doing the wrong thing, because I think it's an insult to all of those who are doing the right thing, and I think there's a growing number of Victorians who are doing the right thing, and I don't want to see the bad and selfish choices made by a relatively small number of people in any way take away from the mighty job that the vast majority of Victorians are doing. It isn't easy, but people are, my sense of it, and Victoria Police can take you through some of this later on today. I'm not quite sure what time the briefing is, but Rick and others will take you through that in more detail. But I think the vast majority of Victorians, and a growing number of Victorians, are staying at home when they should. They're following the rules. They know that unless everyone does that, we won't get to the other side of this second wave as quickly as we otherwise would. We don't want to delay that. We don't want to stall that. by people making really bad choices. But you're talking about, you know, millions of Victorians making hundreds of different choices every day. Just think about that for a moment. Like it's wildly variable, very personal. Some people will always make bad judgments, but my sense of it is that number is actually going down because the number of people who are doing the right thing is going up. Now, because we've got under the state of disaster clarity, we've got higher penalties. I think police, you know, they've done a great job throughout, but they've really stepped up that enforcement, and some of that enforcement is easier now. You know, curfew means you've got very, very few lawful reasons to be out of your house. So some of the conduct is not what we'd like to see. But I just say to Victorians, if you want to get out of this quicker, if you want to avoid a fine, if you want to protect your family and every family, then please follow the rules, and congratulations and thank you to the vast majority of Victorians who are.
Could I just clarify quickly what the rules are for electorate officers? Is it the rule that if you can stay home, you should, if you're a staffer? Yeah,
and then there's a cap. I think it's a couple of staff. I think the front door's shut. So it's one of those ones where, and you know, I think I had a conversation with the PM about this. It's going back a couple of weeks ago now, but probably 3 weeks ago now. There's a lot of assistance being provided through those officers. It can be a trusted point of information. So it's kind of a hybrid. If you can do it from home, you should, but you can have, I think, a maximum of 2 staff, have the door shut, and then, of course, physical distancing and all of those things. So we think that we've struck the right balance there. And there are a lot of people who, I can tell you from my own EO, there are a lot of people reaching out for all sorts of different reasons, and it's an important thing to be able to provide them with what they need. Any other issues? If not, thank you very much, and we'll see you tomorrow.
Thank you.
Was there a favourite Women's Weekly birthday cake in your household? I think work would have liked me to ask you that, but I resisted. What? 40 years apparently since the cookbook's been out. It won't shock you in my household. Mum only ever made boxes.